There are two types of diabetes in basic terminology. There's type 1 and type 2 diabetes. Type 1 diabetes means you can't make insulin anymore and you have to have insulin, and those, in people terms, those are people that are generally born with diabetes, so it's a lot of kids that have diabetes. There's type 2 diabetes that you develop insulin resistance, and a common factor with that are other medical conditions and or obesity is one of the big things. So some kind of breaking it down a little bit, what is diabetes and how does this whole process work? So you eat food and that food gets turned into energy is a basic analogy of it. The big thing that we're getting out of a lot of our diet that we need for energy is glucose. Glucose is turned into glycogen, and that is what powers our system. You need insulin in order to make that process happen, and it's a response to having glucose enter your bloodstream. So glucose enters your bloodstream, insulin gets released from the body, from the pancreas, and it's a paired system that remains in balance. However, if you either can't make insulin, your pancreas is broken, it doesn't make it, you need to have it artificially given to you, or you can't keep up with the amount of insulin that your body makes, then you also need it. So these are conditions that happen in our patients. Cats are much more commonly type 2 diabetics, meaning something has happened so that they can't make enough insulin. Dogs, generally speaking, are type 1 diabetics. Their pancreas is broken and they can't make insulin anymore. So that actually kind of plays into how we plan treatment and what we set owners up for as well. Just keep going through here. Does anybody know what some of the main symptoms of diabetes are?
Increased intake of water.
Yes. Anybody else? There's another big one. Lethargy is another big one that we can often see.
Weight loss.
Yeah, unexplained weight loss. And so does anybody know why we see an increase in water intake? What's that?
They're thirsty.
They're thirsty because when glucose gets to a certain level in the bloodstream, it will start to pour over into the urinary system, and glucose will pull water along with it. So it will naturally dehydrate you as it goes into your urinary system, so you have to drink to try and keep up with your hydration. So the most common presentation of these pets coming in is sudden PUPD, polyuria, polydipsia, that's drinking a lot, peeing a lot, unexplained weight loss despite having a good appetite. And the reason that they're losing weight is their body cannot utilize the energy that it's taking in. So they're eating and eating and eating, but without that paired insulin, that glucose is not transferable into energy. So they're getting lethargic, they're losing weight, and it's because their energy system is out of balance. Does anybody know some risk factors for diabetes in our pets?
Obesity.
What's that?
Obesity.
Obesity is a big one. Other risk factors, so obesity is a big one. Recurrent pancreatitis is another one. There are also breeds that are prone to diabetes, so schnauzers are a big one. Other dogs with other concurrent, dogs in particular with other concurrent endocrinopathies, so dogs with Cushing's disease, thyroid disease, those things can predispose them to having diabetes as well. And there are other medications that can put them at higher risk, and that's typically chronic use of steroids. So these are often discussions that we're having with clients, and it's because steroids are what are called gluconeogenic. They encourage the body to make more sugar. So that's the cause and effect of that. Does anybody know how we diagnose diabetes?
Blood sugar.
Yeah, so it's a blood test, typically a blood sample and a urine sample, so we can see an elevated blood sugar level on a simple blood test. We can also see excess sugar in the urine, and those things paired along with clinical signs can be indicative of diabetes. There's another test that sometimes we'll add on if the whole picture doesn't fit, or to just be sure. That's another simple blood test. Does anybody know what that is?
Fructosamine.
Yes, so the fructosamine level, and a fructosamine level gives us a better picture of what the blood sugar has done for a couple of weeks rather than just the day that they come into the office. And sometimes we'll utilize that because there is something else that can cause us to see a high blood sugar level that isn't actually a continuously high blood sugar level, and that's stress. So if you go into fight or flight mode, your body wants to power you with energy to get the heck out of here. So some of our patients will do the same thing in here when we take a blood sample from them. Their body says, oh my gosh, and will release excess sugar into their system. Cats are a little bit more prone to do that than dogs, so those might be some things that we'll see. Does anybody know how we treat diabetes?
Yeah.
You know what, make it like 900.
Yeah. So insulin is the most common thing that we need to utilize, and it is something that is
That's fine.
only available in
Hold on, people.
injectable format. And that's because I don't make any, you need insulin. So dogs will always need insulin until science develops some other organ system or some other way to create that for them. Cats, generally we're using insulin. There are a couple of new oral products that are out there. Bexacat and Savelgo are oral medications that basically prevents the glucose in the bloodstream from being absorbed and causes them to urinate it out. So it's not an oral insulin. It's a different management of the system, but it only works for cats because they are still making insulin. None of us doctors here have utilized these medications yet because it's very case specific, but that may be something else that comes up down the line. So, is diabetes something manageable?
Yes.
Yes. Is it a lot of work?
Yes.
Yes. Do they become very familiar with all of us?
Oh, yes.
Yes. But can these dogs and cats have a good quality of life? Yes. So that's the bottom line is yes. This is a disease that is complicated, but and usually owners who are very overwhelmed initially, and that's where we come in is to help support them and walk them through it. But there can ultimately be other big consequences associated with it. Blindness, financial distress, death can ultimately be something associated with diabetes as well. Not the common scenario if diagnosed early and treated early on, but still a big condition, so something to be aware of. Anybody have any questions about diabetes? I'm sure you know everything there is to know now.
You're a great
Okay.
teacher.
Oh, thank you. Oh, cool.
Oh, could you get your insulin remission?
Oh, yes, that's a great question. So, some of our patients, so if somebody is still, their body's still making insulin, so our kitty cats, sometimes there is, we are able to get these cats to go into remission, meaning they don't need us to do anything else for them because we're able to get their system back in management where the glucose that they're taking in can be paired with the insulin that they are making. So early treatment, so saying starting insulin or starting one of these other oral medications can be part of the management plan. Weight loss and diet management are the other big kickers in that. So there is hope for some of these, for some of our feline patients to truly go into remission and no longer need insulin or other medications. They typically will remain at risk, but will hopefully no longer need to have other intervention and just monitoring down the